He was the only one that actually dealt with pediatrics that was in the area. So I went and saw him, and whenever we went and saw him, I thought it wasn't clubfoot. I was hoping that it was just something that needed to be moved, or, you know, the bone, or, but he said that it was clubfoot. The Achilles was too tight, so that's why he needed the surgery, to loosen up that Achilles so that his foot could move, because it was forward, real far forward. He came in and told me everything that he was going to do, and he told me it was just going to be three little cuts. That's what really surprised me, that, you know, they could just go in there and they could cut, and it just was tiny little holes in his foot. And they didn't actually have to put him all the way under. He was he only took like 2 small little puffs of gas to where he was kind of, you know, out of it a little bit. And he handled it really well, really well. It didn't affect him. He wasn't in any pain. I was blown away by how the staff was. Each one of them came out, which I thought was incredible, because each one of them came out to talk to me, to tell me what their job was for in the surgery room, which I really did appreciate, because I was having a heart attack. I didn't want to hand off my son to one of the nurses. But Dr. Leland's always been really good with him. He's always been good with them. So he wears these little bow ties, so where whenever he bends over, the kids don't grab his tie and choke him. And he's always really, you know, talks to him, and he just makes him feel good. But I mean, it was worth it, you know, because if it's going to make him be able to do what he wants to do, sports and everything else later on in life, then that's what I want for him.